So I'd like to read a statement from a part-time instructor at CSM, Laura Waltuck. When my students don't turn in work on time, it's usually because they're working full-time or exhausted, or they or a family member have been sick, or they need more skills-based help, or they're struggling with motivation and a fear of failure that's resulted in avoidance. As an educator, I'm very flexible on deadlines, as long as there is clear communication and accountability. In this spirit, my question to the district is, what's going on? Why didn't the district offer any negotiating dates for the month of October? Why has it been over a month since AFT provided the district with a cost analysis of part-time health coverage, and there's still no response? Part-time faculty want to know why this process has been stalled, and we'd like accountability for this stall. I want to go to a good dentist that I have access to through a group plan, and I want to go to the eye doctor using my insurance. I want new glasses, and I want to not have to squint so much while grading student essays. I want to know these appointments are on the horizon for me in early 2023. And the fact is, I should have access to these appointments now, but I don't, in part because I'm working without an updated contract. And I'd like to be working with a current one, in which I have informed consent about the benefits and salary that come with my current work, and that I receive by showing up and doing my job. According to a recent survey by CFT, 44% of part-time faculty in California have put off getting medical care because we can't afford it. I could share with you my story about a stressful gap in coverage with my covered California plan, but you don't need a vulnerable performance of my precarity to act on this issue. You can ensure the negotiations are done on time according to the possibilities of the district's budget, the funding set aside by the state legislature for this very issue, and the district's values, of which equity is central, because this is the work that's been entrusted to you and is your job to oversee. In other words, the assignment is currently overdue. What's your plan for this? A diversity of districts, from Marin to Peralta to Los Rios to San Diego, provide healthcare plans to part-time faculty. Some of these districts are not particularly wealthy or thought to be progressive, two characterizing qualities of our district. Why not commit to being a model employer? The real reason to give part-time faculty access to good healthcare plans is that by having our care needs met, we can devote more energy to our students, and we're less likely to be forced out of an unsustainable job. We are asking the district to provide part-timers who work at least 40% time the same healthcare plans and employer contributions it offers full-timers. The budget and trailer bill passed by the legislature this year make it possible for you to be refunded 100% for these costs. So I ask you to move forward with adopting and integrating this plan into our current contract and to expedite the negotiating process. Thank you for your time tonight.